Hello everyone, I'm Dr. Zarka Lateef from ADC MythBusters, and today I'll be discussing about the histopathological slides that are asked in exam. Now, before going into details of how you need to identify a particular slide, we first need to know how a basic oral epithelium looks like under a microscope. So, as you can see on the picture here, you have got 4 layers of the epithelium. Starting from the base, we have the basal cell layer. The cells in this layer are cuboidal in shape and they have their nuclei directed towards the basement membrane, and they keep on dividing constantly, and that is how your oral mucosa grows. On top of it, we have another cell layer which we call as a prickle cell layer, because the cells in this layer, they are connected to each other at specific points only, which gives them a thorn-like or a prickle-like appearance. Then on top of it, we have got another cell layer which we call as a granular cell layer, because the cells in this layer have specific granules which we call as keratohyalin granules. Then towards the surface, we have of course the keratin. Now, in order to identify any particular slide as a normal epithelium or mildly, moderately or severely dysplastic epithelium, we need to keep certain things in our mind, few points in our mind, which will help us in labeling a particular slide as mild, moderate or severely dysplastic. Now, starting from the normal epithelium, there are certain features that you need to note while you are checking on the histopathological slides. Firstly, in the normal epithelium, the basement membrane is going to be intact. Then the basal cells are going to be cuboidal in shape. As I told you, they are going to be slightly elongated. Then as you move towards the surface, the cells will go on flattening, which means the basal cells will be slightly cuboidal in shape and the topmost cells will be flattened. So this is what we call as cellular stratification. This is the feature of a normal epithelium. And then of course the keratin will be always towards the surface. These are the features of a normal epithelium. Now coming to dysplastic epithelium, you have first mildly dysplastic epithelium. In that you are going to see that the basement membrane will be intact, the basal cells will be cuboidal, but nucleus size will increase in less than 1/3 of the epithelium. So basically you will be able to see the purple dots inside the cells, they will be more pronounced, okay, they will be bigger, and this change in the size of the nucleus will be noted in less than 1/3 of the thickness of the entire epithelium, which means that the bigger nuclei will be more concentrated towards the basilar layers. The upper layers will be fine, okay, they will be just like the normal cells. Then stratification retained to some extent, but basal and suprabasal cells increasing in size. As I told you that stratification is the feature of a normal epithelium. So normally we see that the basal cells are the biggest in size, and as we go towards the surface, the cells go on shrinking and flattening. But in the mildly dysplastic epithelium, you will be able to see that even the suprabasilar cells will be bigger and cuboidal in shape. Okay. Then of course keratin will be towards the surface, which is again feature of a normal epithelium. So only two changes you're going to see in mildly dysplastic epithelium. One is that nucleus size will increase, and then second is that suprabasilar cells will appear bigger or cuboidal in shape. And these changes you will be able to note in less than 1/3 of the thickness of entire epithelium. Okay. Now coming to moderate dysplastic features, you will be able to see that the basement membrane will be intact again. Then the basal cells will be cuboidal, but nucleus size will be increased in less than 2/3 of the epithelium. And then the stratification will be retained to some extent, but basal and suprabasilar cells will be increasing in size. And this change will be seen in up to 2/3 of the width of the epithelium. So the features that you have to see is same. That is, you will see that the nucleus will increase in size and the cells will also increase in size as you go from base towards the surface. But in the mildly dysplastic epithelium, it will only be confined to 1/3 of the width of the epithelium. But in moderately dysplastic epithelium, you will see that up to 2/3 of the width of the epithelium is involved. Okay, So that is the only difference. The features are same, but the extent of change in the cellular presentation will be more in case of moderately dysplastic epithelium. Then again, keratin will be towards the surface. Now coming to severe dysplastic features, again the basement membrane is going to be intact. Then the basal cells will be cuboidal, but nucleus will increase in size in more than 2/3 of the epithelium. Stratification will be lost, uniform thickness of cells throughout the epithelium. There will be no flattening. Then keratin will be seen towards the surface and also within the epithelium. Now this is the difference. Again, you have to check the similar 2 points which you did in other 2 slides, in other 2 categories. That is, you will see that nucleus will be increased in size, and then the cellular size will also increase. The feature of stratification will be lost. But in case of severely dysplastic epithelium, this change will be more widespread. Okay, so it will be in more than 2/3 of the width of the epithelium, both the increase in the size of the nucleus as well as loss of stratification. So the extent of the damage will be more. And also another feature that you are going to note here is that besides being on the surface, keratin will also be present within the cells. Okay, you will be able to see some pink aggregates in the cellular part also, okay, in within the epithelium also. So that is again a feature of severely dysplastic epithelium. Okay, so now coming to, this was about mild, moderate and severe dysplasia. This is a pictographic representation of how you can you know understand the normal, mild and moderate dysplasia. So normal dysplasia, you can see all, no, in normal epithelium you can see all cells are pink in color. Then in mildly dysplastic you can see there are some green cells which are basically abnormal cells, but they are confined to less than 1/3 of the thickness of the epithelium. In moderate dysplasia, you're seeing that green cells are more in number and they're more widespread. They are involving almost 2/3 of the width of the epithelium. Then in severely dysplastic, you can see that most of the cells are green in color, most of the cells are abnormal, and it is spreading beyond 2/3 of the width of the epithelium. Then you have a phase which you call as carcinoma in situ, which means that all the cells in the epithelium are abnormal. They are they have lost stratification, they have increased nuclear size, but the basement membrane is still intact. So everything that is happening is within the epithelium. It has not gone beyond the confines of the epithelium. That is what you know by carcinoma in situ. Then once the basement membrane is breached and once the cells start invading the deeper tissues, which means the connective tissue, we call it as squamous cell carcinoma or invasive carcinoma. Now this is how you understand the grading of oral cancers, okay, starting from mildly dysplastic up to squamous cell carcinoma. Squamous cell carcinoma and carcinoma in situ have not been asked in exam yet, but still you need to know, maybe they can ask in future. So this was all about how you need to identify a mild, moderate and severely dysplastic slides. I hope you all have got a better idea of histopathological part of ADC exam. So if you want me to make more videos regarding histopathology, please do let me know in comment section. And if this video is helpful, please don't forget to like, share and to subscribe to our channel.